Okay, so warm welcome to everyone once more. And just to remind you that as we go through the session, when you join, please start by typing the city and the country that you're connecting from into the chat window. And, we really look forward to active participation from all of you. You have excellent experiences to share, and I'm sure you will have a lot of questions. So please don't hesitate and ask your questions in the chat. Our only request is that please do not click the ask to share the audio and video button that you will see. Wait for us to invite people to join the panel. We may not be able to invite everyone. However, request you to not press this button as it will, kind of disrupt the speakers. How we will go through the session is we will have a presentation from the speakers. Katya is already in the room and we will begin really quickly. And we will have question and answer sessions. So make use of the chat window and send your questions to us. And yes, we do have invited scholars who will share their stories about, their work in terms of capacity building in HSS. And at the end, we will have another round of Q&A before we wrap up and we move on to the next sessions of the conference. So Charlotte, shall we start?
Yes, Soini, thank you very much. So I think we'll just turn towards Katya herself, and then she'll go ahead with the presentation. And as Soini said, while the presentation is going on, we encourage your active participation. So your thoughts, your comments, and your questions on the chat, our eyes will be there to be able to go through the questions and especially your comments together. Thank you. Over to you, Katya.
Yeah, thank you very much. I hope the technology will not leave us alone. My name is Katya Szemionek. I'm working as senior specialist in the health systems and immunization strengthening team at the Gavi Secretariat for the last 4 years. And before, I worked predominantly for more than 10 years on health system strengthening areas in various countries, mostly in fragile contexts like Somalia, like Palestine, like Afghanistan. And I would like to give you an overview of Gavi's work in health system strengthening, but I'm looking forward. Let me see if this works. To your contributions later on. So can you all see my screen in full size now?
Yes, Katya, we can see your screen.
So can I start?
Yes, please go ahead.
Okay, wonderful. So
but
this
it's not full size. It's
not full size.
Mm-hmm.
How do I?
So, but just to encourage, it's the presenter mode that is on. Just to encourage those that are in the room, if you want to enlarge, you can actually enlarge your screen and hop in by clicking on an arrow that's at the top right hand of the screen in order to mask the chat, and then you'll be able to view the slide decks better.
Okay, wonderful. So I was supposed to give you an overview of Gavi's health system immunization strengthening support. So let me start first with the fact that the Gavi Alliance is an alliance of partners. It was established in the year 2000 to increase immunization coverage in the poorest countries. By then, it was created during the Davos Economic World Forum. Wealthy countries have substantially increased their coverage for key immunization outcomes, but not the poor countries. So the idea was to create this alliance between the alliance partners. You can see them, the World Health Organization, UNICEF, Bill Melinda Gates Foundation, and the World Bank, and other partners like the donor communities. You see the private sectors, civil society organization, to really support countries, the poor countries, to boost their immunization outcomes and to get more children vaccinated. So then we come to the next slide. You can see nicely laid out Gavi's missions and interventions is the saving of children's life and protecting the people's health by increasing equitable use of vaccines, in lower income countries. So we have three main pillars of support. One is our health system strengthening support, which goes through cash grant to the various Gavi eligible countries. The other one is our vaccine support. So we finance the vaccines that go to countries, but with the caveat that the better economically a country is off, the more the country will co-finance the vaccines until the country would transition out of this Gavi support. And the third pillar is our technical assistance pillar, where we provide targeted technical assistance through Alliance and other partners to very sensitive and important areas of work. So let me move to the next one. This is just an overview. Can you hear me okay?
Yeah, we can.
Okay. So this is just a quick slide to what the impact has been up to now. So you can see we have been immunizing more than 800 million children. We have been preventing more than 14 million future deaths. 16 countries have already transitioned out from Gavi support. This means they can fully self-finance their vaccines. Countries have had economic benefits that were more than 150 US billion, and we have reached 85% of the world's children population with immunization. So let me then focus on these strategic areas. All of you who have been working in health system strengthening, you know that health system strengthening is a vast area of public health. So within the Gavi Alliance, we had to focus on a few that we found were very critical to really achieve good immunization outcomes. So one, and I have heard this so many times in the Teach to Reach conferences, is the quality of data. We need good quality data, not only to understand if our coverage has increased, but also what is our denominator, what is our target population, where are our children and how many they are. So the quality of data and use is one of the key pillars of health system strengthening support. I spoke about the sustainable financing. This does also apply, and we look increasingly into programmatic financing and transitioning out of Gavi support. This is, for example, that a country can pay for the health workforce on the long run and is not dependent on external resources. I spoke about the supply chain and vaccine management. You can imagine you have the vaccinator, you have the vaccinee, but you need the vaccines, and you don't need the vaccines in your central store. You need the vaccines in the last mile health facility where you provide the vaccination. So you need very complex and well-functioning supply chain system, and this is one of our strategic focus area investment. Equally, leadership demand, leadership management coordination, it's the governance of a national immunization program, which is critical to tie all these pieces together and to officially manage a program in order to reach the last child. And lately, this has fortunately drawn much more attention than before, and I saw this morning in the session with your Francophone colleagues that the demand for immunization has really suffered during the COVID-19 pandemic. The demand for immunization is a critical ingredient to reach to the children. If the beneficiary, the caregiver, does not understand the benefit of vaccination, is not informed about potential side effects, is believing in false information, and there is a certain mistrust in immunization, then we have a real problem, because then we offer all these immunization services, but if there is no demand from the community, we will fail. So the new Gavi 5.0 strategy, and you find this on our webpage, I just put a little sticker here, has a very strong focus on equity. So number 2 is the health system strengthening focus, and it says strengthening health systems to increase equity in immunization. This means we need to make sure we reach the last child. Overall, if you look at our 68 Gavi supported countries, coverage has stalled at around 80% DPT3, but there's still this remaining 20% that we really need to look out to reach. And very often these missed communities, missed children, these zero-dose children are living in marginalized and vulnerable communities. So this is the new focus of our Gavi 5.0 strategic period. So let me then build on that. To reach out to these missed communities, we need to tailor our support and we need to strengthen the related health systems component. So we first do that whilst we properly analyze the data we have. We find out how many children we are missing out for immunization. And you might have seen that during the pandemic, we missed out a lot of children, even more than we missed before. And then where are these children? Where are they living and why are they missing immunization? Is there no access? Is the facility too far away? Or are there other barriers like paying for the transportation? Or is the caregiver, the mother, not empowered to leave the house and bring the child to immunization? So secondly, now with all these data, we identify the bottlenecks, but then we need to think, what do we do to overcome these barriers? And this is then depending on what you would have found. So this is why this is so important to have a tailored approach. You need a different approach, for example, to reach children in an urban slum setting than in a very remote area or than in a conflict-affected area. So this is what I wanted to say. You need to target and tailor your investment within your health system strengthening efforts, because otherwise we can continue investing and spending in health system strengthening areas. But if we do not be focused and tailored, we will not reach to the last mile to the remaining missed out communities. So by now, because we already started with this focus towards the missed children, we have over 70% of our current HSS grants that have targeted interventions at sub-national level. And you all know what it means. For us, it means, yes, we have to invest in central data system, but we also have to invest at the last mile level, at the sub-national level, at the district, at the facility. And this is what we try to increasingly do. So the title of the session is Capacity Building for Health System Strengthening. We are not an agency that specifically does it, but we try to make a few tools available to countries that we think can be very helpful. And I just have pulled out a few. So the issue around demand for vaccination, vaccine hesitancy came out very strongly this morning in the Francophone group. And I wanted just to let you know we have a wonderful webpage. It's called the Demand Hub, where you can find anything you want to understand around creating demand for vaccination, how to overcome demand barriers, how to deal with the community. There is a whole chapter on the importance of good service experience to make the caregiver return. So please take note of this website. It is rich in information. You can be part of this community. And this is just one example. Then you find two very interesting documents that are on our webpage. I can also put them on the chat. One is the use of Gavi support to maintain, restore, and strengthen immunization in the context of COVID-19, because we found it is absolutely critical to support countries to restore the immunization services that have been disrupted due to the pandemic, the various reasons, social distancing, vaccine hesitancy, or simply the lack of flowing of funds to the last mile. So you find this very interesting guidance, which is full of innovations, including on capacity building. And equally, there's a very interesting guide only to give you some ideas on the innovative approaches that countries have been using throughout the pandemic to prepare their health workforce, their supply chain manager, their API manager to deal with the pandemic. And it's only innovation that have been worked very well and that are ready to scale them up. Then we have a few examples. I mentioned the leadership management and coordination before. This is largely what we mean when we speak about capacity building at the central management level. So we have a number of partners who are embedded technical assistants in the management units of an immunization program. There are various offered by the Yale University, by other partners who really sit in the ministry and help then API managers to better use the data, to plan, to develop strategic investments. So this is one of our strategic focus areas. And similarly, some of you might have heard of the Center of Excellence in Kigali. that trains supply chain manager with a great success. So there are many more examples on our webpage. These are just a few. And the conference for us is also to harvest your ideas, and the session at 5 o'clock is also about innovative approaches to learning and performance management. So what remains in conclusion is, despite all the success we have, we still need to increase countries' capacity to design their interventions, then to implement them and to coordinate them in order to reach to the last child. What is always a critical point for us is, what is health system strengthening versus support? You can imagine that if we fund a large proportion of per diems or outreach activities, this is more support to the functioning of the immunization program, but the strengthening would be that we come up with innovative approaches for a really solid supervision system that would mentor the vaccinator and improve his or her performance over time. All in all, hand in hand together, we work with governments, but often in fragile countries, there is an issue of the fiduciary risk, and then the risk appetite also from our organization. And last but not least, we spoke about the data. It's quite a challenge also to measure progress in health system strengthening. If you work in health system strengthening, it's a way of operating is not so easy to measure progress, while it is much more easier to see a vaccination coverage that would increase. So I think this is the end. This is my last slide. So let me hand back to Charlotte and team. I click on stop sharing. Yep, and then back to you.
Okay, so thank you very much, Katja. So Hidi, over to you.
Thank you so much, Katja. That was wonderful. I think, it was very informative and very insightful as well. We have been asking the participants to, share their questions and, their comments. So Kevin has also mentioned that there is something called Step 2.0, which is also another great tool that Gavi offers. So would you like to tell us a little bit about this tool, if you can, Katja?
I think it was Kevin. It was a supply chain related tool. Can that be? Maybe he can talk about that. Is that possible?
Okay, so if he's in the room, he could ask to share his audio and video, and we will invite him to the panel. Kevin, if you are here and you're getting me, you can click on the blue icon on your screen, ask to share audio and video, and we'll invite you to the panel to talk a little bit more about that. So before we get to Kevin, there was also a comment, Sohini, from Indogasit UFO that says manpower capacity enhancement is the best investment any organization can make. So I thought that could be a very compelling statement. I just wanted to read that out, and also invite those who are in the room here with us to also share their comments and their questions. Now we have on the panel Sohini, there is also Burema Kabore and Eric Womeno. So Burema, if you have any question, you can go ahead and unmute yourself, or any comments concerning, okay, I see Kevin has asked to join the panel. I'm inviting him. So Burema, while Kevin is joining, please, can you go ahead?
Okay, thank you. First of all, I will thank Katja for a great presentation. I think that the content is very, very, very interesting. My question is about measurement, because by now we have the 2015 recommendation from WHO to drive vaccination survey, coverage survey. Now with COVID-19 and the new recommendation and new methods you have developed, how can we manage with survey now? Because we are trained to use the 25 recommendation from WHO. This is my question.
I understood you're talking about a vaccination coverage survey, right? And there were guidelines from 2015. And are you asking now, are there new guidelines that came out? I think this question would be better posed to somebody at WHO. I don't know if somebody is in the room, because it's natural that guidelines to conduct immunization coverage surveys are being updated every 2 or 3 years. Are you referring to that?
Burema, please unmute. Okay.
Yeah, this is my question. How can we update the guidelines for those who will conduct survey?
Okay, thank you, Burema. We got your question, and in line with what Katia said, I'll probably encourage you to join the WHO, one of the WHO sessions tomorrow, and probably there you'll be able to get a response to your questions.
With
thank you, Burema.
So let's have Kevin tell us a little bit about Step 2.0, since we have him in the room. So Kevin, thank you so much for joining, and we'd love to hear from you.
Yes, and I will be just very quickly. First of all, Katja, thank you so much. Appreciate the work that you do. You know, certainly we appreciate the work that Gavi does. The slide that Katja had originally shown in her presentation was really the very first iteration of STEP, which ran from 2015 to 2020. And you saw 340 plus professionals were trained across 20 plus countries through 12 sessions. The only thing I just want to point out is that Gavi has for one thing, Gavi has refreshed STEP. That's why we now have STEP 2.0. And it very much is focused around a problem-solving scenarios. And it's about teams coming together and collaboratively problem-solving. I would be remiss if I didn't also mention that there's a sister program offered by Gavi as well. You've got Step 2.0, which is really about team building and team effectiveness. And then you have a second program, as Katja referenced, led by Yale, but anchored in local institutions. And it's called EpiLamp. And it is designed to be kind of a second iteration, a little bit more advanced. And it's actually for project management and project, again, effectiveness. So just wanted to put those up there while we had the opportunity. Appreciate the opportunity, Katja and team, to add these comments. Great session so far. Appreciate everything. Over.
Thank you so much, Kevin. Katja, we have a question from Manasseh in the chat, and it says, what is the way forward for routine immunization support in developing countries in view of the COVID-19 pandemic, which has destroyed world economies?
Yeah, thank you very much. I have mentioned this guidance on maintaining, restoring, and strengthening. We are very much aware about the disruption that the pandemic has created of routine immunization program and still will create. So within our existing support to Gavi eligible countries, we have offered a number of flexibilities and are offering the use of a number of innovative approaches, which are all described in that guidance that countries can use to ensure they rapidly reach out the children they have missed. We understood as well from what we see in our countries that at times it's very difficult to find these missed children and then to find a solution to reach out to them. So we are supportive of, for example, using new digital tools to identify those children and invest more in outreach or what we call PIRI activities. These are the periodic intensified routine immunization services to rapidly find these children and vaccinate them. We continue monitoring the situation, and some of you might be involved in this work. It's extremely important for us to closely liaise with the API managers, but also with other public health professionals in those countries who work on these plans to rapidly restore essential health services, primary healthcare services, of which we need and want to be part of in order to really push to the fact that the children that have been missed out are being reached and are being sustainably reached. It's a difficult path. I know that countries are overwhelmed right now, also with a request for the COVID-19 vaccine. But as I said, we have 68 Gavi eligible countries, and we have country teams led by senior country managers who work day and night and hand in hand with the EPI manager to help them finding these children and then making resources available to reach to them. This is one of our core area of work.
Okay, thank you. Yes, Sohini?
Go on, Charlotte, that's okay.
All right, so thank you very much, Katya, but I'm seeing like there are more and more questions on the chat. I think the question from Ebrima Barrow is in line with the previous one. I'll read Amel Atahi. Is there any plan from Gavi in support of capacity building of HCPs? Amel, I don't know what the abbreviation actually means. I have received an offer to support my country, Sudan, in COVID-19 preparedness as consultant to support training and supervision. So, Katya, you're muted. Katya, please unmute.
I started putting a link in the chat. Okay, so as I said earlier, this is the link to the Maintain, Restore and Strengthening guidance. So we support countries through the government, and Sudan has only recently applied for a large HSS investment. So anything that the country with the team, the EPI managers, the partners have put forward is sitting in these applications. So our usual cycle of grant provision is 5 years, and Sudan was they just had submitted a proposal last year, which has been approved. So anything, I do not know at what level you work, would be interesting to see, but and if you're connected to your national and subnational API managers, that you can find out. The proposal was approved, it was returned with some question, and is now in the grant making process. So I hope your concerns would have been addressed, but I cannot tell you the details. Maybe when I see your questions. So it would be important to connect then to see what is then the plan for this HSS support.
Okay, thank you very much, Katya. I'm sure you've answered her question, because actually she said she has been invited to serve as a training and supervision consultant. So yeah.
There is a very large component of capacity building and supervision in this new grant. I remember very well that we put a lot of emphasis also to connect it in Sudan. There are various great innovative approaches for training and learning of health workers, and we put quite some emphasis into this grant. So I hope that you will be a beneficiary of this contribution. Thank you.
Thank you very much, and I see, and thanks to all those who are leaving very wonderful and appreciative comments on the chat, just appreciating your presentation, Katya. So there's Ilya Hussein that says, what is the effort put in place to make available resources to health workers that will improve demand for COVID-19 vaccine, considering the great damage that rumors and misconceptions are making on the vaccine? And I think I'll also just take this question from Benson Leia, and forgive me if I don't get your name right. Say, how can we institutionalize defaulter tracking systems in hard-to-reach areas?
Yeah, as for the demand, this is one of the critical areas for Gavi to be addressed in these days. You all know that the vaccine hesitancy has increased during the pandemic. This is why we have made additional tools available in the demand hub. I think it would be great if you could connect to that and you could be one of the participants and create your own community of practice within your country, within your region. There are a lot of useful tools. And we often, when we work with countries on demand, we support countries in a 2- or 3-fold approach. One is through the mass media, that is the radio and the television. One is through social media, but then you can also have a lot of demand-related work through involving your community leaders, your CSO. You can do a lot of small-scale things through SMS and applications, digital tools. You can all find this in the Demand Hub, and there are also contacts that you can reach out and have some more information. So I think the next question, can you remind me, was related to the remote areas, right? What is the strategy for remote areas? Was that how to institutionalize that? Was that the question?
That's correct, Katya, yes.
Okay, so what we do when we go to, or when a country is ready to plan for a new investment, that we put a lot of emphasis on the data collection, as I said, at subnational level. So very often, most of you are familiar with the administrative data that is being collected at facility level, but it's at times not of great quality. Very often, you know that from your countries, the denominator is not precise, neither is the nominator. So we encourage countries to very much rely on, at times, local surveys or community-based registries or birth registries or some similar data system that can be used to triangulate the data and then find out what is the most hardest hit districts, where is your district with the highest number of missed out children, and then we do not have a solution for everybody. This needs to come from the country, but then it's important to develop with the community leaders, with the district leaders, a clear plan that clearly outlines how you want to reach out to those children. Very often we give a lot of emphasis to community-based healthcare, to lady health workers. But what is always important is to really keep track of your children, to have proper data sources that would allow you have reached out to those children. Also important is that you have a system for the filter tracking. There are also a variety of tools you can use, like SMS reminders, like tickler boxes, etc. So to institutionalize it, we don't play a role in that. It's the government who needs to institutionalize those approaches. But what is important to first find those children and make a proper diagnosis why they have been missed. It's often not only that there is no facility, often there are other barriers that are very, very important to identify first.
Thank you very much, Katya. We have just a little over 14 minutes for this session, and I think it's about time we return to listen to some experience sharing from the field. And I see a lot of questions on resources, that is additional resources that people can refer to. As far as the slide deck for this session is concerned, you will get the link to that. So I think we'll get to see how to consult with Katya even after the session. Links to additional resources that can be shared with you. We'll make sure they are shared also on the Telegram platform. Okay, so now I would like to turn towards Sohini. Sohini, you have the slide deck for the question for participants, and you have been involved in health systems strengthening in your context. So will you kindly share your experience with us?
Yes, sure, Charlotte, I'll do that. Let me quickly put up the questions here for the others as well. So Katya, I have been working, on a particular project. So my name is Sohini. I work with John Snow India, and we have been working on a capacity building project, which is under Gavi's HSS 2 here. So, we wanted to share a little bit about that. Our project is called Rapid Immunization Skill Enhancement. And we have been, working on making learning modules for health workers. During 2020, we have developed, 5 e-learning modules which are completely on immunization-related topics, and they have been disseminated to the health workers with a learning management system on a mobile application. What is the problem that we were trying to solve here? There were multiple issues. One issue is that especially in India, we've had rapid changes in guidelines related to routine immunization. We've had new vaccine introductions. And for each of these, it is difficult to quickly disseminate this kind of knowledge and information, considering that we have a very large cohort of health workers. So that was one of the problems that we were trying to solve. And also when we did a capacity building needs assessment, we realized that there was also a difference in terms of, the consistency in the content shared during trainings, the quality of facilitators. So that was also something that we wanted to tackle. My role in this whole project was mainly in terms of content development. And, we've worked really hard. We've used learning methodologies like adult learning principles. We've used gamification. The whole content has been made in a very interactive manner with quizzes, with games, so that means that learners were not only able to go through and listen and read content, but they were also able to actively, participate by giving inputs, giving answers. We spent a lot of time in ensuring that we made the content very, very user-centric. We made the application very user-centric because this was one of the first times that we were trying to do some capacity building using a mobile app. So we did keep all that in mind. Who or what helped us? Everyone helped us. We ensured that we took the buy-in at every stage from the Ministry of Health and Family Welfare. And also in India, health is a state subject. So we were always in constant coordination with state government officials in the areas that we were implementing the project in. Of course, we had enormous help from Gavi itself because the project is funded by Gavi, and we also, could always reach out to Gavi representatives for any other expertise that we needed as well. What was really surprising to us is coincidentally, our project was launched during the pandemic. So our first module went live in March 2020 when COVID-19 was, really surging through the country, and we thought that health workers will probably not be, able to access the learning or really go through the e-learning content as they were really burdened with work. But it was an incredibly pleasant surprise that they were so enthusiastic and they were so open to learning that a lot of times we could see it on our dashboards that people were logging in, in the middle of the night to take these sessions, and we had a lot of active participations. They were very motivated. We got a lot of input from them in WhatsApp groups. So this was really surprising and was very, very encouraging as well. And I think the lesson that we learned was, like I mentioned, that we had to keep all our stakeholders involved in every stage. We had national working groups, we had state working groups, who gave us their inputs, and because they were a part of the collaborative efforts to really launch this capacity building intervention, our journey was pretty smooth sailing. So in terms of the question that I really have is, we all realized, especially during the pandemic, that virtual learning is something that we will have to pivot towards. But there is still skepticism, people really rely on face-to-face trainings. And of course, that is the traditional way of trainings, and we would continue with that as well. However, if you could share your experience or tips in how do we pivot people to accepting different and more innovative ways of training, which are helpful during the pandemic situation, or which helps us, virtually reach learners in hard to reach areas as well. So thank you so much, Katya, and I'm looking forward to listening to you on this.
Thank you so much, Sohini. You know that we have the follow-up session on innovative learning where we have invited an education technologist to be with us who has just recently started working with Gavi. I do not have a solution to that, but what I can say, as you rightly said, it's also a little bit about changing the culture of learning and to transfer the message that learning and training is not only about having new information on a certain subject, which at times is predominantly done through digital training. I also think it's not digital training alone that can solve problems. You also need, and Cecilia will speak about that later, you need high frequency dose training. This means to remind you every now and then about what you have learned. You also need, for example, peer-to-peer learning. You need to learn from each other. This can be digital or person in person. But then also what is important, and I wanted to ask you how you measure the impact of your RISE program, you need to accompany then the trainee over time. It's like a mentoring, supportive supervision process that you need to make sure what has been learned would be translated into the daily practice. So I do not have a clear-cut answer to you, but I think the digital training per se had so much success in the course of the epidemic because people simply couldn't come together. But the most important is not the content, as I said, it's not the learning content, is how you digest it and how you then apply that. And this goes beyond digital learning. This needs a bit more, like I said, mentoring, supervision, peer-to-peer, which can be either or. It can be digital or not. So I think the question is less, is it digital or not? It is to understand there are different cultures of learning, but we need to find a way that is most efficient. And this is why I think in my last slide, I said a challenge for us is to measure you can say the value for money or the impact of investment, or how can we measure that the new methodology of digital learning has an impact on the performance of the health workers? And then you have automatically answered your question. It can be either the digital or other, but the best would be probably a mixed approach. Maybe others have also some views on.
Thank you, Katya. Yes, totally. I agree that, we would need to go in for a blended kind of a training approach. And, once we are able to go out in the field, we are looking forward to, cementing the e-learning knowledge that people have gained with face-to-face interactions as well. So we have a few more questions here. Charlotte?
Yes. Yes. Yes, so I think we have like just 4 minutes, and before taking a look at the questions that are there, Katya, and thank you very much, Sohini, for sharing your experience. I just wanted to read this comment from Joyce Moriti that says, yes, we need to change the culture of learning, especially among adults, learning who are the drivers of vaccination for children. So that is why I'm encouraging everyone that is in this room to join us at the top of the hour. You heard Katya talked about it a short while ago. We'll be looking at the session on learning innovation. So it will really be great for you to join the session, and you will get to listen to Cecilia talk actually about how we can change the learning cultures and consider things we have to take into consideration when talking about adult learning. So I think I'll just read maybe 1 or 2 questions because we are already at the end of the session. We just have 3 minutes left, and Katya will just comment on them and at the same time just give her closing remarks. So there is a question here from Bernice Ashley Alma that says, how do we get individuals accept? Okay, I think Katya already talked about vaccine hesitancy a while ago. Simon Ajay says, what role is Gavi playing in supporting countries with cold chain equipment in the introduction of COVID-19 vaccine? And we have Suresh Kumar that says, how is Gavi investing in countries' technical teams? I think those 2 questions are related. And I want to thank you, Katya. You've been going through the questions on the chat and actually responding to so many of them. So I'll just turn towards you now for your thoughts on those 2 questions and closing remarks.
Yeah, thank you very much. I tried also to put the link to the COVAX facility in the chat. Of course, now we need to help countries in gearing up their cold chain equipment for the rollout of COVID-19 vaccine. There is a lot of ongoing work for these countries. You find the information in the webpage. It's extremely critical. You all know that the COVID-19 vaccine, some need a temperature that's much lower than where usually vaccines are being stored. So the countries need to beef up their cold chain equipment facilities. So this is all work in progress. Then the other question, technical teams. When a country is preparing an application for a grant, there is one session only dedicated to support or to think around the technical support that is needed to beef up the various technical teams at the country. So I said, I think my first slide was, this is our third support stream. You have the vaccine support stream, you have the health system strengthen stream, but then also is a specific pot. And this has been accelerated now during the pandemic to make additional technical assistance available to countries. But this always goes in negotiation or in a planning process with the government. So you told me, and I think Reda also wanted us to close. So thank you very much. For us, Gavi is a funding organization. It would be very important to better understand what you see in the field in your area of work. In terms of capacity building needs, I can see there is a lot of things coming up that very much relate also to the current situation and vaccine hesitancy and around that. The organizers of the conference and we will stay in touch after the conference to really better understand the needs and then to try specifically with the design of our learning approaches to respond to some of those. So here was I hand back to you, Charlotte and Suhini.
Very much, Katja. Thank you so much for this insightful session. It was wonderful listening to you. And a shout out to Charlotte for helping so much during the session. We have our rapporteurs, we have our support team who's been engaging with the participants and trying to solve their queries. So thank you everyone once again for your active participation. And sorry we could not take all your questions, but see you all in the following sessions and in the remote networking as well. Thank you.